My name's Tom Daniels. I'm a PhD student in the School of Social Policy at the University of Birmingham. Well, my PhD is in social policy and my research is looking at the way that health spending decisions are taken within the English National Health Service, specifically looking at whether or not we should involve the public in decisions to withdraw funding from certain services. Well, the University of Birmingham has an excellent international reputation and I knew about the University of Birmingham having previously done my Masters here, and the Health Service Management Centre, which is the department that I'm part of, has very high standing within the NHS, and I was aware of their work and aware of some of the academics that work there, and I was very excited and fortunate to have the opportunity to work with them. My research was funded by Universitas 21, which is an organisation which joins together international universities, of which Birmingham is one. That funding provided me with a stipend to cover my expenses throughout my study, and also gave me the opportunity to study for a year abroad. And I was fortunate enough to spend a year at the University of British Columbia in Vancouver. In addition to this, the University of Birmingham have also provided funding for me to attend conferences both internationally and within the UK as well in my field. So, what's it like being a research student at the University of Birmingham? When I became a PhD student, I came straight out of full-time work, and I continued the attitude that I'd had at work whilst I was studying. I treated it like a full-time job, and I think that's served me well over the course of the 3 years when I've been doing the PhD. Throughout the course of a normal week, earlier in the PhD, you may have seminars, you may have some methodological training, you might complete some short courses to help you with your research. Then in the middle of the PhD, you would carry out your research, conduct literature reviews, etc. And then towards the end, your week would be spent writing up your findings. Helping me along the way with that has been my supervisor, or supervisors should I say, and I see them regularly. We work in the same building, so I see them on an informal basis, and also I see them more formally on a monthly basis with a pre-arranged supervision session, and we discuss my progress, we discuss any problems that I'm having, the work that I'm doing, and really try and improve and develop my study. In terms of plans for after I graduate, I'm intending on returning to the NHS, which is where I worked prior to carrying out my research study. When I go back into the health service, I feel that I'll have gained skills in not only research methods, but also in evaluating evidence, in ensuring the rigour of the evidence that I'm making decisions based upon, and in also writing as well, in writing papers, in writing reports. These are certainly skills that I've developed over the last 3 years, mainly thanks to doing the PhD.